if you want, you can wash them, take them off, but save them. Okay? Or if you don't have any extra pair. Okay. So today we're going to talk about of upper limb. Unfortunately, because you were too slow to take on the gloves, we haven't taken the best specimen. Yes. The best was taken before us. Because you were too slow. Yes, it was taken by another group just in front of us. So then we'll work with those which have left. So, button up your coat, please.
Sorry.
You too. There's only 11 in your group.
21 have injured. One is proper.
Okay, so muscles of upper limb, they include 4 main regions. There will be shoulder girdle, arm, forearm, and hand. Shoulder girdle muscles include those muscles which originate from the bones of the shoulder girdle, like scapula and clavicle, and insert into the humerus. Their purpose is to move our arm, mostly providing adduction, rotation, and flexion with extension. The largest muscle of the shoulder girdle is called the deltoid muscle. Do you know where your deltoid muscle is located?
Yes. Here.
On this side. Yes. So on the cadaver, we can find it here. So this will be deltoid muscle. Deltoid muscle, it originates from the spine of the scapula, acromial process, and acromial end of the clavicle. So here it is, our deltoid muscle, and it is inserted into the deltoid tuberosity of the humerus distally. If only a posterior part of the muscle is contracted, it will slightly move our arm posteriorly. Anterior part will move it anteriorly. But if all the muscle will contract simultaneously, it will cause the abduction of our arm. Okay. Next muscle of the shoulder girdle is called subscapularis muscle. Here it is located. Subscapularis. Subscapularis muscle is originated from the subscapular fossa of the scapula, which is on the costal surface. That's why we can see it only from the anterior side here. And it will be inserted to the lesser tubercle of the humerus, providing the abduction and medial rotation of the arm.
Okay.
On the dorsal surface of the scapula, we can find 4 more muscles of the shoulder girdle. First of them will be supraspinatus muscle. Here it is, supraspinatus muscle. Supraspinatus muscle originating from the supraspinous fossa of the scapula. Its tendon is passing under the acromion process above the shoulder joint, above the capsule of the shoulder joint, and inserted to the top of the greater tubercle of the humerus. This muscle provides the abduction of the arm, but only to the 90-degree angle. Like this. Yes. Arm, not forearm. Then, below the spine of the scapula, we can find infraspinatus muscle. Infraspinatus muscle originating from the infraspinous fossa of the scapula, and also is inserted to the greater tubercle of the humerus, but below the tendon of the supraspinatus muscle. This muscle will provide the external rotation of the arm. External rotation of the arm. Then below the infraspinatus muscle, we will find 2 teres muscles. 2 teres muscles are 2 teres minor, teres minor, and teres major muscles.
Antagonistic to each other. Antagonistic to each other. They are actually opposite.
Yes, of course, because they are originating both from the inferior angle and the medial border of the scapula. But Teres minor muscle, it inserted to the greater tubercle, and teres major passes anteriorly and it is inserted to the lesser tubercle. It means that they will provide the opposite movements. Teres minor will provide the external rotation, while teres major will provide internal rotation.
Okay.
What? You're not agree? Here. What else?
Levator.
Tell me please, which muscle is this? What is this?
Trapezius.
Trapezius.
Trapezius. Okay, this one.
Latissimus dorsi.
Latissimus dorsi. And here.
Serratus.
Lorgismus.
External.
Erector spine.
Erector iliocostalis, longissimus, spinalis. So erector spinae muscle. Okay. Okay. Here are some parts of the rhomboid. Okay, but no, обратно только. Okay, now let's talk about some moments of topography. So, here, first of all, we have to talk about the axillary fossa. Yeah? Axilla, it is the region, it can be also called the armpit.
Yeah.
Yeah? It is the region where a lot of blood vessels and nerves are located, and you have to know about its walls. Yeah, like what forms the walls of the axillary fossa. So anteriorly, it will be covered by this muscle. Which muscle is this?
Trapezius.
No,
That's
no, no.
That's nice.
Serratus.
Pectoralis major muscle.
Pectoralis major.
I have already turned it.
Okay.
So it is pectoralis major muscle. Posteriorly, we will find the subscapularis muscle, and here the latissimus dorsi muscle.
Okay.
Medially, there will be the lateral wall of the thorax, yes, and also here will be, for example, serratus anterior muscle, serratus anterior muscle. And on the lateral side, there will be the shaft of the humerus and surgical neck of the humerus. And in the axillary fossa, we can find axillary artery with its branches, axillary vein, and also the cords of the brachial plexus, which provides the innervation of the upper limb. Also from the axillary fossa, we can find the two foramina. There will be trilateral and quadrilateral foramina. Here will be quadrilateral foramen, and here will be trilateral foramen. Their borders from the anterior and from posterior side, they are different. From anterior side, border of both of these foramina will be subscapularis muscle.
Yeah.
And inferior will be teres major and latissimus dorsi muscles. Quadrilateral, so these two foramina, they are separated from each other by the long head of triceps muscle.
Okay.
Quadrilateral foramen is located more laterally here,
Where?
here.
Okay.
So it means that its superior wall will be subscapulary muscle, inferior wall will be teres major and latissimus dorsi muscle, lateral will be the surgical neck of the humerus, and medial will be long head of triceps. And here we will find trilateral foramen.
Trilateral foramen.
Yes, it means that it has only three walls. Superior wall will be subscapularis muscle, inferior latissimus dorsi and teres major, and lateral is a long head of triceps. Quadrilateral foramen is needed for passage of the axillary nerve and posterior circumflex humerus artery. Trilateral is needed for passage of the circumflex scapular artery. Both of these foramina, they can be seen from the dorsal side also. And from dorsal side, They are still separated from each other by the long head of triceps. Inferiorly, they have the teres major muscle, and superiorly, they have teres minor muscle. And here we'll find the trilateral foramen, and here quadrilateral foramen.
Okay.
As soon as we are here, we can look at the muscles of the arm from its posterior side. Muscles of arm, they are divided into two compartments, anterior and posterior compartment. Are you okay?
Yes.
Yeah, because if you are not feeling well, please tell us. Okay? So anything can happen, yes, and we don't need anyone to fall down here. This skin.
ज़्यादा बच्ची मत मारो, छोटी बच्ची हो क्या?
Oh my god.
Oh my god.
It's almost leather.
Skinny leather.
It's the skin from this arm.
Animal here.
It's just not separated from the olecranon here. So here it's still safe on the elbow. Here.
Oh, that is beautiful.
Oh my god.
Is she female?
It's a male.
It's female.
I don't know.
What is it?
That female. Anna.
Why do you think so?
It's very small.
And तो रोशन के भी
Please continue, sir.
Okay, anyways. Please continue.
रिद्धि
So anterior and posterior compartments of the arm are antagonistic to each other. Anterior compartment includes flexor muscles and posterior extensor muscles. The largest muscle of the posterior compartment is the triceps brachii muscle. So here it is, triceps brachii muscle. Why is it called triceps brachii?
Because it had.
try mean three.
Yeah, triceps have three muscles and
Triceps muscle has three heads.
Heads.
Long head,
Long, short
medial head, and lateral head. Yeah. The best visible is the long head. So here it is, the long head. Yes. Lateral medial heads, they are deeper, and they are originating from the shaft of the humerus. Long head is originating from the infraglenoid tubercle
Yes, yes.
of the scapula.
What?
Infraglenoid tubercle of the scapula.
Okay.
And this muscle, its tendon is inserted into the olecranon process of the ulna. Yes.
Tendon of the long head of triceps.
Tendon of the long head of triceps brachii is from the infraglenoid tubercle.
To the
And all the muscle, all three heads, they are inserted to the olecranon process. All three heads. Yes. By this long head, it will help with the extension of the arm, and altogether muscle will form the extension of the forearm. Yeah? Also, there will be one more muscle of the posterior compartment which is not quite visible on this exact arm. It is called uncaneus muscle. Yeah? Uncaneus muscle, it is rather short, present on the posterior surface of the arm, and also inserted to the olecranon process, and helps with the extension of the forearm. So, you want to find the picture?
Yes.
Yeah, there it is. Yeah, uncaneus muscle. No.
ये तो
It is in the blue one, light blue.
देखा तो तुमने क्वेश्चन लिखा
Further. Further. Yes, here it is. But you haven't pointed at the beginning, yeah, because demarcated by the nerve.
Okay. I get it.
So this will be the uncaneus muscle.
So short head of tricep is very
Short head of triceps doesn't exist. There is long head, medial head, and lateral head.
lateral.
Yes.
But bicep head too.
So now we're going to the anterior compartment, yes? And then the anterior compartment, there will be three muscles. Well, all of them are flexor muscles. The most superficial of them is the biceps brachii muscle. Biceps brachii muscle called biceps brachii because it has two heads. It has the short head and the long head.
Yeah.
Short head is located more medially. Yes.
Is the long one.
Yes. But you are looking on the cadaver and think that long head is shorter than the short head. Yes. Yeah. But that's not true, because long head originated from the supraglenoid tubercle of the humerus, from here, yes. Then its tendon passing above the shoulder joint, then passing in the intertubercular sulcus of the humerus, covered by the synovial vagina. And after that, here we can see only the ending of the tendon of the long head. And short head, it originates from the coracoid process of the scapula, directly. Both of these heads, they are connected in one tendon, which is inserted to the radial tuberosity. So this head helps with the flexion and also supination of the forearm.
Okay. The shorter one. Which head for the flexion?
Both of them for the flexion. Medially to the short head of biceps, we should find the coracobrachialis muscle. Coracobrachialis muscle originates from the coracoid process of scapula and inserts to the humerus, to the shaft of the humerus, helping with the flexion of the arm.
Okay.
And the last muscle in the anterior compartment is called the brachialis muscle. It is visible under the biceps brachii muscle. So here it is brachialis muscle. And brachialis muscle, it originates from the shaft of the humerus, from its anterior surface, and inserts into the ulnar tuberosity, helping with the flexion of the forearm.
So like the back, this also has real superficial interpretation.
On the arm, it is not so crucial because there are not so much muscles on the arm. But when we will go to the forearm, we will find several layers there. So, what else do you have to know on the arm? On the arm, there are also present two grooves. Medial bicipital groove and lateral bicipital groove. Medial bicipital groove is located here. So this is medial bicipital groove. And in the medial bicipital groove we have anteriorly it is formed by the biceps brachii, posteriorly by the triceps brachii, and medially the shaft of the humerus and brachialis muscles. This groove is needed for passage of multiple structures such as brachial artery, brachial veins, median nerve, ulnar nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and basilic vein. All these structures, they are present in the medial bicipital groove. On the other side, we will find the lateral bicipital groove here. Lateral bicipital groove will be between the biceps brachii and brachialis muscles. Further, it continues into the groove between the deltoid and pectoralis major muscles. And this groove is needed for passage of the cephalic vein. Cephalic vein.
पूरी आग हो जाती है.
We have to learn all the cephalic vein.
So you will have to learn what passes in different grooves, foramina, and so on, but just at least the names of these structures.
Okay.
Yeah? But don't go too deep into their location function. Just know the topographical structure.
What passes through it?
Yes.
Okay.
Yes. Also, one more structure in the arm which you have to know is the brachiomuscular canal, or its other name is the canal of the radial nerve. It is formed by the radial groove on the humerus and the triceps brachii muscle. So it will be, its anterior wall will be the humerus, its groove for radial nerve and posterior wall will be the triceps brachii muscle. Here we can find the entrance to this canal, so this will be the radial nerve which enters to this canal. Along with the radial nerve there will be a deep brachial artery pattern in there. And the ending of the canal will be on the lateral side between the brachialis muscle and brachioradialis muscle. So here the continuation of the radial nerve passing out of the canal of the radial nerve. Any questions about arm? Now let's go to the forearm. In forearm there are also two compartments, anterior compartment and posterior compartment. In some sources you can find also about lateral compartment, but we will include the muscles of the lateral compartment into the posterior compartment. Between these two compartments there will be the muscle on the lateral side which is called brachioradialis muscle. Brachioradialis muscle, it originates from the lateral epicondylar crest of the humerus and insert into the radius into its distal part. Yeah, and brachioradialis muscle, yeah, it will help also with the flexion of the forearm. Next, the anterior compartment. Anterior compartment of the forearm is quite complicated because of amount of muscles and layers on it. So in anterior compartment of forearm there will be 4 layers of muscles. And in the first layer we will find 4 muscles, in second layer we will find 2 muscles, and third layer, in second 1 muscle, in third 2 muscles, and in the fourth one also 1 muscle. So totally it will be 8 muscles, not so much, but usually students find them rather confusing because of this, how it looks like. So the most...
Next time we have to give vibe on this cadaver.
Yes. It doesn't work like this. So, first muscle, which is tiered on this, yes, it is called pronated teres muscle, which originates from the medial epicondyle of the humerus and the proximal end of the ulna. And it will be inserted to the shaft of the radius, lateral surface of the shaft of the radius, and it will help with the pronation of the forearm.
Pronation.
Pronation.
Okay.
Supination, pronation, yeah, not pronation.
Yeah, okay.
Because it will rotate the radius medially. Pronated teres muscle here, this one.
Okay, so this is the muscle
Where
which
does
helps
it
in
originate?
lectures.
It originates from the medial epicondyle of humerus and the proximal end of ulna. Yes, listen more carefully. I have already told about this. So, next muscle from here. So we are counting from the brachioradialis muscle and going medially. So, pronated teres, which is ruptured. Yeah. Then there will be flexor carpi radialis muscle. Flexor carpi radialis muscle, which originates also from the medial epicondyle of the humerus. Actually, all the muscles of first 2 layers in the forearm, they are originating from the medial epicondyle of the humerus. This muscle is needed for flexion of the wrist. Next muscle will be the palmaris longus muscle.
Yes.
Here, palmaris longus. If you will look closer to it, you will find that it's really thin, and its muscular part is much smaller than its tendinous part. Its tendon, it is the only tendon of the anterior compartment which passes above the carpal palmar ligament and retinaculum flexorum. That's why you can easily visualize this tendon on your wrist here.
Okay.
Here, you see? I'm showing you.
I got it. This one?
Yeah,
Okay.
exactly this one.
फ्लेक्स करना अपने आप को ऐसे करना ये
नहीं
देखो
वो तो वे नहीं है
So the easiest way to show it, so connect your thumb with your fourth finger and flex the.
yeah got it
So
okay I got it
So this muscle is attached to the palmar aponeurosis. Palmar aponeurosis, it is the plate, yeah, connective tissue plate, which covers the palmar surface of the hand, yes, covering the blood vessels, nerves, and tendons.
okay
In humans, this muscle is not really functioning as it should. Yes, but for example, if you look at some of the animals, like
apes
like cats, for example, yeah, it helps to cats to release their claws, for example. Claws. Then next to the palmaris longus muscle, we will find the first muscle of the second layer. The only muscle of the second layer, which is flexor digitorum superficialis muscle.
Flexor digitorum what?
Superficialis. Flexor digitorum superficialis muscle. In the hand, it separates into 4 tendons, which are attached to the middle phalanges of the fingers from 2nd to 5th.
second
Yeah.
fifth
Yes. To all fingers except thumb. Coming closer, so here we can find these tendons. Yes, this is tendon for the second finger, for the third finger, fourth finger. Yes, and there should be also separate tendon for the fifth finger here.
okay
So these tendons, when they're coming closer to the middle phalanx, they are separated into 2 parts. To these 2 points, they are attached to the base, to the 2 points on the base of the middle phalanx.
yes
So this muscle is providing the flexion in the proximal interphalangeal joint here.
yes we just saw
The last muscle of the superficial muscles is the flexor carpi ulnaris muscle. Here is
Yes.
flexor carpi ulnaris muscle, which also provide the flexion and ulnar deviation, medial deviation of the hand. Yeah?
it's on the superficial.
Yes, it is on the superficial layer. So first layer includes pronated teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris muscle.
okay
Second layer includes flexor digitorum superficialis muscle. Then third layer will include 2 muscles. There will be flexor digitorum profundus muscle. Here it is under flexor digitorum superficialis. Here it is. This muscle is tendon also divided into 4 parts, which are going to the fingers from 2nd to 5th. But its tendon is passing under the tendon of the flexor digitorum superficialis muscle, and when it is coming to the medial phalanx, so here will be like the tendon of the flexor digitorum superficialis muscle and flexor digitorum profundus muscle passing between these 2 parts of this tendon. To insert into the distal phalanx of our fingers from 2nd to 5th.
Yeah. These are deep
it's
layers.
like this
Yeah, it's
deep.
yes, it's the 3rd layer, and this muscle it will provide the flexion of our fingers in the distal interphalangeal joint.
so it's like this
Yeah, like
or
this.
one?
Distal. Distal.
Okay
This knowledge will help you with the differentiation of the tendon ruptures. For example, I'm doing this carefully. So, for example, if you have a patient who came with some cuts on the hand and tells you that, doctor, I can't flex my finger in the proximal here, yes. but I have slight movements in the distal part. There will tell you about the rupture of the superficial. And if the patient tells that I can flex it in here, but the tip of the finger is not flexing, that it means that it have cut the deep flexor. Yes.
The superficial is one. Then
So
Proximal.
no, superficial is inserted to the middle phalanx, deep, profundus, which means the inserts to the distal phalanx. Then one more muscle in this third layer is called the flexor pollicis longus. Here we have the tendon of the flexor pollicis longus. So why is it ruptured again? Because students like to do like this.
Okay.
Yes, to pull this tendon, yes, to look how thumb is moving. So this muscle, it is inserted to the distal phalanx of the thumb and flexes the thumb. And the last muscle on the anterior compartment of the forearm is in the fourth layer, yes, which is called pronator quadratus muscle. It is located in the distal part of the forearm, originating from the distal end of ulna and inserting to the distal end of the radius. Helps also with the pronation. So we have two pronators, pronator teres in the first layer and pronator quadratus in the fourth layer.
It goes cross.
No, it just goes like this, like a bracelet on the anterior side. It's a square shape
Oh, okay.
plate
Got it.
here. No, this is first of all, this is posterior surface, and those that you are showing it is called the retinaculum extensorum,
okay.
or extensor retinaculum. To find the pronator quadratus, next page. And here you can find it, pronator quadratus muscle.
Yeah, I got it.
Or on the next page, look at the next page. No.
मेरे मुंह में दे दो.
This one is fine.
There is certainly one picture which shows us all the.
अरे पानी इधर है भाई.
Here you can see. Yes.
अरे जा रहा था.
Okay, guys, this one.
There will be supinator muscle.
Pronator teres muscle.
Okay. This is
This is quadratus.
both are anterior.
So all the pronators there on the anterior surface and supinator will be on the posterior surface. Also, you have to know about grooves on the anterior surface of the forearm and about the cubital fossa.
Yes.
So, what is the cubital fossa? You're so tired? We are just standing here for 20 minutes, maybe half an hour. How long?
33.14. 33 minutes.
33 minutes. Only 33 minutes.
Okay, let's continue.
You should be young and healthy.
Yeah?
Yes.
Falling down.
You are falling down? Why are you falling down?
Maybe it's a family problem.
You have some dizziness? Or-
Yes.
Yes? So, sit down, please.
तो तुम्हें फॉर्मलिन प्रॉब्लम है तो यहाँ
Yeah. Sit there on the bench. You can also open the window.
Lay down.
Help him. So, you sit down. You
On your anterior.
In the
The
head.
blood
Circulate in the brain.
and the blood pressure.
Yeah.
Next time we'll study on you.
Are you okay? You look pale.
Roshan Cadaver.
Because we are getting new cadavers.
Really human.
Okay, so cubital fossa. Cubital fossa, I suppose all of you know where it is located. Yes, in this region. So walls of the cubital fossa, there will be the brachialis muscle, the brachioradialis muscle, and the pronator teres muscle. So these muscles, they will do the borders for the cubital fossa, and in the cubital fossa we should find the the brachial artery and its bifurcation, and the median nerve passing there in the cubital fossa. Also superficially in the cubital fossa, in the region of the cubital fossa, we will find some superficial veins like cephalic vein and basilic vein, which are frequently used for taking the blood samples or providing the intravenous injections. So on the in the distal part of the forearm, on its anterior surface, can find three grooves. First groove is called the radial groove or the lateral groove. Second one will be median groove, and third one will be medial or ulnar groove.
Okay.
So
Lateral, median,
and median, yes. So radial groove will be between the tendon of the brachioradialis muscle and flexor carpi radialis muscle. In this groove, we will find the radial artery passing. So here, radial artery. Radial artery, it is artery where you usually try to find the pulse. So to find the pulse, you have to use this groove, yes, in this. So here will be
Radial artery.
Yeah, radial artery, and there will be, you are pushing it in the radial groove of the forearm.
I got it.
No, here is you are trying to find the ulnar artery,
This.
and here will be the radial. But it is not correct to find the pulse with your thumb, because
you have to use the two.
three,
Three.
actually three other things.
Pressure that touch.
Because when you're pushing it with the thumb, you can't 100% differentiate which pulse you're feeling, the pulse of the radial artery of the patient or pulse in your thumb.
Two.
Yeah, because your thumb has rather large artery, yes, and you can feel its pulsation if you push it with the thumb. Correctly is to measure the pulse with your three fingers, because there are also different techniques, like
Yes, I can.
So, the pulse of the thumb is distally or supra?
in the thumb it will be of course distal, because with artery in the thumb.
You are seeing any vein here?
Not
Vein or artery any?
As a man also
artery,
trying to
yes.
pregnant
Here,
to-
for example, will be the brachial artery.
Okay, so this is the artery. And veins?
Vein. So here are present some veins. Yeah.
Veins are superficial.
Not all the veins are superficial. Some veins are
Pulmonary veins are
superficial.
not superficial.
No, some veins are superficial, but most of the veins, they are passing along with the arteries. So we have brachial artery, it's rather deep, and we have brachial vein which is passing with this. This one, median groove. Median groove is present between the tendon of the flexor carpi radialis muscle and flexor digitorum superficialis muscle.
Okay.
In this groove, we can find the median nerve. Median nerve, here it is. And the ulnar groove will be present between the tendon of the flexor digitorum superficialis muscle and flexor carpi ulnaris muscle. In this groove, we can find the ulnar artery and the ulnar nerve,
Okay.
both of them.
Yes.
Also, we have to mark that tendons of the flexor muscles. They are held in their position by the structure which is called flexor retinaculum. All tendons except the tendon of the palmaris longus muscle. Yeah? Any questions here?
No.
Okay, now let's move to the posterior compartment.
किताबा में तो बता देंगे एकरा पे कैसे बताएंगे सब एक ही
Upper limb doesn't have any fascia.
Of course, it has.
Every part of body has fascia.
Different muscles, yeah, they have their own fascia, for example, yes, they have some intramuscular septums, for example, on the arm, which separate the anterior compartment from posterior compartment. Yes, and also covers these medial and lateral bicipital grooves. Yeah.
So also, vulnerabilities are interosseous membrane.
Yes, of course.
So how does the rotator muscles work? Not the rotator, pronator and supinator.
And how the interosseous membrane will just will not let it to rotate.
So it does. So it's a okay. It doesn't pass through.
No. Pronator is only on this surface. Yes, so it pulls the radius turns. Yes, so pronation happens. Supinator is on the posterior side, so it turns the radius to the lateral surface.
So interosseous membrane is between.
Yes. So this is interosseous membrane. Here it is, interosseous membrane. You see?
Okay. Yes.
That's all. Okay, on the posterior compartment we will find mostly extensor muscles and supinator muscles. Supinator
Okay.
Posterior.
Was there any nerve passing through the
Through-
interosseous membrane? What was that?
this one.
Yes, this one.
This one is anterior interosseous artery.
Okay.
No.
Okay, posterior.
Posterior compartment of the forearm. So here also counting from the brachioradialis muscle. So brachioradialis muscle. After brachioradialis muscle, we will find extensor carpi radialis longus and extensor carpi radialis brevis muscles. These two, two muscles. Both of them are originated from the lateral epicondyle and inserted to the second and third metacarpals. This muscle helps to extend the hand. Next to the extensor carpi radialis longus and brevis muscle, there will be extensor digitorum muscle. Extensor digitorum muscle also separates into 4 tendons. Yeah, it is better visible than with the flexor muscles here. So here we have the extensor retinaculum, the structure which covers and holds these tendons, and here we will find the tendon of the extensor digitorum muscle, which separates into 4 tendons, passing to the second, third, fourth, and fifth fingers. Next muscle will be extensor digiti minimi muscle. Extensor digiti minimi muscle forms the separate tendon for extension of the little finger.
Okay.
And the flexor carpi ulnaris muscle, which is inserted to the fifth metacarpal, and it will provide the extension of the
Carpi radialis.
extensor carpi ulnaris.
Carpi.
Here we have 2 extensor carpi radialis muscles, longus and brevis. Here we have extensor carpi ulnaris. Deep layer of the forearm muscle includes, first of all, supinator muscle, which is not visible on this cadaver
Why?
because it is covered by other muscles. Next one. So here we have several tendons which are attached to the thumb. These tendons will be the tendon of the abductor pollicis longus. Abductor pollicis longus. Also here should be the tendon of the extensor pollicis longus, but it is not present in here. I suppose it is tiered. And extensor pollicis longus muscle. Between these tendons, abductor pollicis longus and extensor pollicis longus, there will be the radial fossa, or the anatomical snub box, which is present, on this side where you have where you are showing, yes, in this place. So. Try to
Relax.
Yeah, you, in your hand it's really well visible. Yeah, here you see this fossa. Yeah, or here. In front of you. Look. Yeah. This is you have to know about its presence because of the radial artery passing in there.
Okay.
radial artery. Here it continues. Also here we can see the artery of the thumb. Yeah, here the artery.
लड़के ने जन्म दिया है.
Going to washroom.
Nausea.
It's all about the smell.
He is successful mother.
He's rather rough.
मैं मिठाई लेके जाता हूँ.
Okay. And one more muscle which we have to visualize is extensor indicis muscle. So this will be extensor pollicis one, and here will be extensor indicis muscle. It is also separate muscle for extension of the index finger.
External indicis and extensor mini.
Digiti minimi. So we have separate extensors. We have two extensors for the thumb. We have one extra extensor to the index finger, and we have one extra extensor for the. What happened?
He is asking for water.
Water.
No.
Anyone?
No.
पीला वाला. सबसे नीचे वाली चेन में, सबसे नीचे वाली चेन में.
There is water. There was water.
Yeah, there's a bottle.
Большая бутылка.
This is usually used for tea, or
Tea.
something.
Normal in India. We drink
Normal bottle.
Okay. Any questions about the posterior compartment of the forearm? Okay, now let's talk something about hand. In the hand, what is needed? So, between different metacarpal bones, there will be some intermetacarpal muscles and lumbricalis muscle, which are not very interesting, but more interesting are muscles of the tenor. Tenor is this elevation near the thumb, and hypotenor muscles, which are here near the little finger. So, tenor muscles, they include several muscles, such as flexor, pollicis brevis muscle. Here we'll find adductor pollicis muscle. Adductor. Also, there will be abductor pollicis brevis muscle and the opponens pollicis muscle. Yes. And on here,
Abductor pollicis muscle.
so yes, abductor pollicis muscle.
Okay.
And here on the hypotenor muscles, we can find the flexor digiti minimi muscle, we can find the abductor digiti minimi muscle, opponens digiti minimi muscle, and the palmaris brevis muscle, which is also inserted to the palmar neurosis. How is he?
Yes, he is fine.
Not so fine. Any questions about upper limb?
No, sir.
No. Okay. Will you?
No muscles on the back.
On the back side, no, there are no
Extensor.
large muscles.
Only tendons.
Here, tendons of the extensor muscles and some deeper muscles between the metacarpal bones.
What is this whole diagram then?
This is palmar surface.
So we
And
have
this
to
one?
learn
This.
So you have to at least know the muscles of the tenor and hypotenor
So
muscles.
then I this all.